Warm greetings from the High 10. It is Everyday Shenanigans on this Thursday, April 2nd, 2020. Hope you guys are staying warm and comfortable in your homes and corona-free. Please be safe out there because this virus is still running rampant in our country and abroad, and I will be praying for all of you. The said information I'm bringing to you is by Newsweek. Confirmed coronavirus cases worldwide past 1 million after doubling in less than a week. The coronavirus has infected more than a million people around the world, according to the latest figures from Johns Hopkins University. The virus, which was first reported in Wuhan, China, has spread to at least 181 countries and regions. The U.S. has more cases than any other country, with more than 234,000 confirmed infections to date, followed by Italy at 115,000 and Spain 110,000. All three countries have overtaken the number of cases in China, which now has a confirmed infected population of 82,400 people. While China has seen a rise in imported cases in recent days, the outbreak has been largely contained, with outbound travel restrictions now lifted in Hubei province. Restrictions are also due to be lifted in Wuhan later this month. But cases continue to soar outside China, and the spread of the virus has been picking up pace in the U.S. The current global epicenter of the outbreak, New York, continues to report the country's highest number of cases, with more than 83,700 confirmed infections to date, including 47,439 cases in New York City. The office of the New York Governor, Andrew Cuomo, confirmed as of Wednesday. While the virus continues to devastate Italy and Spain, having killed thousands, both countries have also reported the two largest number of recoveries. Spain has seen more than 26,000 people recover from infection, while Italy has seen more than 18,000 recoveries. Okay. Both European nations have also shown signs of outbreaks slowing down, with each reporting brief moments of a slight decline in new infections and deaths. In the Middle East, Iran has seen more than 50,400 confirmed infections, including 3,160 deaths. Last week, Iranian President Hassan Rouhani claimed the country's death toll was declining based on a reported drop in number of hospital check-ins. Rouhani said at a meeting with the National Task Force for Fighting the Coronas, among the topics discussed was a report according to which it was evident that hospital check-ins in provinces had declined and that the death toll was declining, both of which are important to us. Elsewhere in Asia, South Korea also managed to contain the spread of the virus after seeing an explosion of around 500 or more new cases per day for a prolonged period. It now has nearly 9,900 cases, including 169 deaths so far. Large parts of Africa have yet to report cases, but the outbreak has spread to several nations, including South Africa, Egypt, Morocco, Tunisia, Ghana, Senegal, among others. Latin America has also reportedly remained largely unaffected, but cases have been confirmed in some countries, including in Brazil, Peru, Colombia, Argentina, Panama, and Honduras, among a handful of others. Top 10 countries with most confirmed cases, and this is as of today, April 2nd, 2020. Number 1 is the U.S., over 234,000. Number 2, Italy, over 115,200. Number 3 is Spain, 110,200. Number 4, Germany, over 84,200. Number 5, China, over 82,400. Number 6, France, over 59,900. Number 7, Iran, over 50,400. Number 8, UK, 34,100. Number 9, Switzerland, over 18,800. And lastly, number 10, Turkey, over 18,100. The graphic below, provided by Statista, illustrates the spread of COVID-19 across the globe. In this said article, you will get a global map of the world, and it will show you the outbreak and the statistics of people infected with the virus. It is a color-coded map of the world. Please log on to Newsweek in this article, and it will show you the confirmed cases. Data on COVID-19 cases is from Johns Hopkins University, unless otherwise stated. This is what the World Health Organization is advising for avoiding the spread of coronavirus disease, COVID-19. Clean hands frequently with soap and water or alcohol-based hand rub. Wash hands after coughing or sneezing, when caring for the sick, before, during, and after food preparation, before eating, after using the toilet, when hands are visibly dirty, and after handling animals or waste. Maintain at least 1 meter to 3 feet distance from anyone who is coughing or sneezing. Avoid touching your hands, nose, and mouth. Do not spit in public. Cover your mouth and nose with a tissue or bent elbow when coughing or sneezing. Discard the tissue immediately and clean your hands. Medical advice. Avoid close contact with others if you have symptoms. Stay at home if you feel unwell, even when mild symptoms such as headache and runny nose, to avoid potential spread of the disease to medical facilities and other people. If you develop serious symptoms, fever, cough, difficulty breathing, seek medical care early and contact local health authorities in advance. Know any recent contact with others and travel deaths to provide to authorities who can trace and prevent spread of the disease. Stay up to date on COVID-19 developments issued by health authorities and follow their guidance. Healthy individuals only need to wear a mask if taking care of a sick person. Wear a mask if you are coughing or sneezing. Masks are effective when used in combination with frequent hand cleaning. Do not touch the mask while wearing it. Clean hands if you touch the mask. Learn how to properly put on, remove, and dispose of masks. Clean hands after disposing of the mask. Regularly washing bare hands is more effective against catching COVID-19 than wearing rubber gloves. The COVID-19 virus can still be picked up on rubber gloves and transmitted by touching your face. And that is the said information, you guys, by Newsweek. So please log on to the said information to get the global statistics if you need to see for yourself a visual aid. I just gave you the rundown of the medical advice as far as washing your hands after each time. Don't touch your face. Don't touch the mask. Don't discard of the mask and gloves in the street either. Don't throw that stuff on the ground. Throw it in a trash bin with a lid. Okay? Stuff you should already know. So frequent hand washing is the remedy for this. You don't have to have gloves on, but they recommend washing your hands. If you wear a mask, don't touch the mask. If you're going from place to place, you need to change those gloves out, because wearing the same gloves all day is deemed unsanitary and will pass the virus along. I'm praying for all of you out there. I see that this epidemic is causing much havoc in our world. And as you see, U.S. is the #1 country with the most cases, and we are at 234,400 confirmed cases of the coronavirus. I don't know what the remedy will be. I'm praying for a vaccination. I'm praying for a cure. But know that if we got this virus from China, and now we have surpassed China, because China is number 5 on this chart done by Johns Hopkins University, that should tell you how messed up the system is. That this disease originated over there, some type of way. And now we, Americans, are #1 with carrying it and passing along, and with confirmed cases. That's a messed up situation. Messed up. And the reason we got it, because we were just walking around doing whatever, weren't listening. Those people have a different way of running things in their country, so their country is more radical as far as making people stay in, and they got all this modern technology they're using to check the people and keep them quarantined and the stats, and that's how they do business. But as you see, they have less cases, and it's died down a bit, way more than how it was when they first had the outbreak. Just saying. Praying for all of you. I'm praying that, as I state, the cure will be found, but I know that in the end, our country needs to have a revised plan for the next epidemic, and this is a learning experience of what to do and not to do for the next time, because if this thing pans out, dies down, stop, whichsoever, America needs to know it will happen again, and it may be worse, and it may not be a 5, 6, 10 day run. Might be Johnny on the spot, you get it, and die. You understand what I'm saying? So we need to have medical staff already on board to help test, view the stats, test the body, autopsies, all that. Already have people lined up to say, let's get a hold of the inside of this person's body, check things out, check their cells, check out everything, and have something already on standby to administer to people to help. And I'm talking about drugs, vaccinations, all that. A plan set in motion. Somebody's going to have to do this because somebody's doing it now. This is just a bad situation because you're talking about so many states facing this epidemic. And there are no words for this situation. There are no words. But we need adequate staffing, medical staffing, scientists. We have to have these people because they're the people who are trained to know these things. And we have to trust they know what they're doing and take their advice, whether we like it or not. And that's the problem I'm seeing in Washington. Somebody with a big head don't really want nobody telling them what to do. But see, we don't have that kind of time to play with you. You know, you don't want to take the advice from the medical staff, then you're just basically saying, let everybody fall over dead and the hell with them. Sometimes you got to suck up your ego and keep your mouth closed and do what's right for the people. Like, share, subscribe, drop your comments below. Thanks for joining me. God bless America. Please stay safe out there. Please adhere to these medical guidelines to keep yourself and others safe from the coronavirus. And I will be praying for all of you. Please pray for me. I am well, I feel well, and I'm thankful. I'm inside, and I'm grateful to be alive. Amen. God bless you. Thanks for listening. Bye-bye.